I'm waiting for two of them to change their names, although I know who they are.
So I just had a thought, like one cool way to also do this would be to create like a green room, right?
Yeah. So Soto's here.
Oh, she is, okay.
Soto.
Yes.
So your kids are good. You're good with your kids with just their first name? Because I see the ones in the waiting room. Daimia, Jocelyn, and Khalees. I believe you want them in anyway, or?
Is there a way that we can send them a message?
I did. I will send another one that says.
And Dr. Reed, can you rename yourself too?
Yes.
Oh my God.
Oh, I love to see all of these faces. So cool. Yes.
Let me post something.
Does it come up? I can't, for some reason, the names aren't popping up for me.
You don't see their names?
Oh, click on participants.
Oh.
Ooh,
Well, you can do that too, but you can hover over the picture with your cursor.
Because I'm sharing my screen.
Yes.
But when I hover, it's not showing. Only when someone talks does it show.
So you know what? If you want to stop screen share for a moment, and then you can see everyone. We can start off like that.
Okay. Hi.
And now I can see that some of you aren't seen. So we need you to be seen if you're here for credit.
And then, yeah, this way we can all get started and see each other. And then Dr. Reed, you can share your screen, and then you'll have that as the main focus of the presentation.
That works. I can't see chat or anything when I'm sharing my screen. So I just need someone to let me know if there's any questions.
Absolutely. I will help moderate that. You don't worry about that. I will get the questions, and students also, you'll be able to ask questions through the chat, but we'll talk about that in a moment. Yes, I see beautiful faces. Yes, good morning.
And students, will you go ahead and just type your name in and your teacher in the chat? And that's how we know you're here.
So we'll be taking roll this morning through the chat. As Ms. Cooper said, you'll be signing your first and last name and your careers teacher. So go ahead and take a moment, open up your chat so we can take attendance.
There we go.
Thank you. So these other students, they've gotten messages?
Yes. So when some of you were in the waiting room, you could see my message, right? About signing in with first and last name. Yes?
Yes, I can see your message, Ms. Cooper.
Yeah, and Khalees tried to come in again, but it's still her first name, so.
Okay.
I guess we can kick them out real quickly if it's not.
Yeah, you want me to go ahead and admit them?
admit one at a time, and as they come in, say sign in first and last name and chat.
Okay, that's Khalees. Well, I thought it was. Who did I let in?
Jocelyn.
Oh.
Jocelyn, will you type in your first and last name and your teacher in the chat, please?
Okay. Now we're letting in Khalees.
Elise, would you type your first and last name into the chat and your teacher as well, please?
And now Ari.
Uh-oh. Miss Soto, is Ari your student?
Ari?
Yes.
Oh, it might be Ariana Duarte. Yeah, she needs to.
If there is an Ari there, we need to see you. You need to sign in your first and last name, or we're going to excuse you from the session.
And Demaya.
Well, yes, Demaya. Put your last name, please.
Okay, there's Ari. And then, Khalees, did you try to log on two different devices?
Okay, so we'll go ahead and remove the other one.
Is that the same Khalees?
Yep.
Okay,
Yes,
yeah.
I'm assuming. Okay. All right, so then good morning or good afternoon. Good afternoon, everyone. It is so wonderful to see your faces. I am really excited that we are able to do this today. We had all intentions of having a fabulous presentation by Dr. Reed on a career in public health at school with many of you. And as you know, that is not possible, but we still wanted to take this opportunity because she was available, and we still know how important this is for you to learn about the possibilities. And so today we have a fabulous presenter, Dr. Rachael Reed, and I'm going to let her talk more about herself and more about a career in public health.
Yay. Well, good afternoon, everyone. Thank you so much for actually attending. Today, I'm going to talk to you about health disparities, race discrimination, and just give you kind of a brief introduction to careers in public health. Let me share my screen. All right. So the first thing I want you to do is just take a brief look at this picture. Think about it for a second, just let it settle within your soul. And feel free to put in the chat. You can just think about it if you want to. But does anything seem wrong with this picture? Does this seem normal? Is this okay? And what this picture is showing is the US maternal death rate. Between the average is the black line in the middle. You have white mothers, which is the green line at the bottom. And then you see Black mothers far, far, far higher. So I'll just let that sit with you for just a second. And then we'll move on. So basically what that picture was showing you was a health disparity. And I'm not sure if any of you are familiar with health disparities, but essentially a health disparity is a preventable difference in the burden of disease, injury, death, or disease, injury, violence, or opportunity to achieve optimal health that is experienced by socially disadvantaged groups. And when they say opportunity, that's more so like access to health care or health insurance. So health disparities are usually most commonly in terms of race, but as it says, socially disadvantaged groups, so that can include gender, sexual orientation, and income level, amongst other groups as well. So just a few examples of what a health disparity is. So we saw the graph, that was a clear health disparity in maternal deaths. So in terms of race, a health disparity would be that Blacks have double the risk of developing high blood pressure compared to whites. An example for gender is that women are more likely to suffer depression than men, and all of these, by the way, are true. For sexual orientations, sexual minorities, so that's any LGBTQ individuals, are more likely to smoke or heavily drink than heterosexuals. And then income level, so low income individuals have worse overall health and higher rates of early death than individuals with higher incomes. So this is a super simple overview, as they are far too many health disparities. There are entire degrees based on health disparities. Right next door at Charles Drew from your school, there is an entire master's program just on health disparities. So this is a very, very, very prevalent issue. And again, this is a very simple overview. And there's actually a lot of crossover between these groups as well. So for instance, there are health disparities for Black LGBTQ individuals, or immigrant groups, like female immigrants or something like that. And then again, there are other groups that I did not mention, but that can also be included in this list, such as immigrant status, geography, so rural versus urban, or even education level. And health disparities should definitely not be taken lightly, because they have very real outcomes on people's health. People experience poorer quality of life and shorter lifespans in these impacted populations. A very clear example of that is what we're going through right now with COVID-19. So as you can see, or as you have been seeing, hopefully, Blacks are actually getting COVID-19 at higher rates and are more likely to die from the disease. So if you take a look at Chicago, Blacks only make up about 30% of the population in Chicago, but they make up 50% of the cases of COVID-19 and 70% of the deaths in Chicago. In Louisiana, my home state, Blacks make up about 30% of the population, but they're almost 60% of the deaths from COVID-19. And here in LA County, Blacks only make up about 9% of the population, but right now they're at 13% of the deaths from COVID-19. And what researchers are assuming is that it's the higher rates of high blood pressure, diabetes, obesity, and cardiovascular disease that are to blame for Blacks being at such a higher risk to die and getting this disease, which of course is a health disparity. There are other factors that may also contribute to this. So things like living conditions, which would include like multi-generational homes, just essentially meaning that Blacks and other racial minorities are more likely to live with their grandparents or people that are from multiple generations. So they can't socially distance or isolate themselves from those older individuals. And Blacks and racial minorities tend to live in more populated areas. There are also different work circumstances that can contribute to this, such as Black and racial minorities being more likely to be essential workers, such as delivery drivers, grocery store workers, things like that. And they don't have access to paid sick leave. So these are people who are actually being forced to go into work because they don't have the option. They don't have the income to actually say, okay, I'm just going to take some days off. And if they do take some days off, they don't have the option to be paid for those days. And then also lower access to care. So that's not having health insurance, there are language barriers, etc. So all of these factors go into what we call social determinants of health, which can actually be a driver for the health disparities that we see in the world today. The good thing about social determinants of health is that it kind of breaks it down very thoroughly in all aspects of health. So essentially, social determinants of health are conditions of the environment in which people live, are born, work, play, worship, and age in. And essentially, these factors can have an impact on their health, their functioning, their quality of life. So something as simple as your zip code can actually determine how long you'll live, what you will die from, or what quality of life you will have. But the good thing is that just like any kind of discrepancy in these social determinants of health can drive health disparities, in the same way, if we start to address some of these social determinants of health, you can actually start to reverse health disparities, and that is what's called health equity. Additionally, health disparities do tend to be very systematic in nature. So essentially, there are racist policies and our practices that continue to limit access and opportunities for racial minorities. So things like mass incarceration or school district funding policies. Make sure that's on my notes. All right, so as you can see on this list, Discrimination is under one of those social determinants of health, so I kind of want to go a little bit into that, because this is one of those drivers of health disparities that's included in social determinants of health, but it's starting to get a lot more individualized attention. So first, I just want to go over some terms. So a lot of people like to use racism and discrimination interchangeably, but they are not interchangeable. So racism actually is a construct that refers to a system that categorizes individuals into race and then uses those categories to preferentially allocate resources or societal goods to those who are deemed superior. Quotation marks. And this causes the development of racial ideologies and beliefs. And then those racial ideologies and beliefs are what actually are used to justify discrimination against those who are then deemed inferior by the system of racism. So with that being said, discrimination is actually defined as the unjust or prejudicial treatment of different groups of people, especially on the grounds of race, age, or sex. So how does this play into your health? This is not just some erroneous thing that just happens and then you go on about your way. Researchers have actually found that research is a chronic social form of stress. So what that means is that it actually activates the stress pathways in your body. So it causes inflammations, it makes just a lot worse, which we'll get into. And it also increases your participation in unhealthy behaviors. So people who experience a lot of discrimination, essentially they tend to be what researchers would call stressed. And they are more likely to participate in unhealthy eating, alcohol use, or tobacco use. So then discrimination, the stress of experiencing these discriminatory experiences is associated with multiple health outcomes such as diabetes, high blood pressure, heart disease, and death. And it is very important to mention that this is regardless of age, income, education, and other factors. So researchers have actually gone in and looked at how this impacts health, and they have taken these other factors into consideration. And even when they're considering the person's age, their income, their education, etc., the stress of experiencing discrimination is still playing a role in the development and severity of diseases. And that brings us back to our first picture. So again, we see here that Black women are experiencing a ridiculously high rate of maternal death. So what could possibly be causing this? Why is there such a massive difference between white mothers and Black mothers? A lot of people would like to say, okay, it's income, but it's not necessarily income. I don't know if you remember the story of Serena Williams, but I would think Serena Williams has a good bit of money. And Serena Williams almost died giving birth to her very adorable baby girl. It's not education. Researchers have actually shown that white mothers with high school education actually have better maternal outcomes than Black mothers with doctoral degrees. It's not access, it's not nutrition. None of these factors actually account for why there's such a ridiculous difference between white maternal death and Black maternal death. The only real justification, in my opinion, is the experience of race and discrimination. So it may be this underlying stress of a lifetime of dealing with discriminatory experiences that may end up causing all of these health issues. Again, it causes all of this inflammation in the body, activates all these stress pathways that makes diseases worse. And then once you have a child, it then increases your risk of having complications and dying. That's a possibility. Also, going back to Serena Williams and her actual experience and countless other mothers' experiences, you can actually research it and look at it, and countless other Black mothers will say that their concerns are not taken seriously when they are giving birth to their children. So they'll say that they don't feel well, something's wrong, and essentially doctors will just kind of brush it off and tell them they're overreacting or they'll be fine and do nothing about it. And then these mothers are literally dying. So, like I said, this is something that is just, it's happening at a ridiculous rate. And doctors not taking these mothers seriously is really causing them to die. And that's something that's not only happening with maternal death rate. So researchers have actually seen that when it comes to prescribing medication, because physicians tend to think that Black individuals will not actually take the medication, they actually delay even prescribing medication for things like blood pressure or diabetes, just on the assumption that they're not going to take it anyway. And I also have a story of a guy that I work with. So I do a lot of work in South LA on stroke prevention. And I work with this amazing group of people who live and work in South LA. One of the guys, his name is Richard Horton. He loves me sharing his story, so it's fine if I say his name. But years ago, he went to his doctor. His blood pressure was high. Normal blood pressure is about 120 over 80. His blood pressure was consistently 150, 160 over, I'm not sure what the bottom number was. But essentially, he said that his doctor told him, well, you're Black. You're supposed to have high blood pressure. We're not going to worry about it. You're fine. This went on for a good 10 to 12 years, and this man has now had 2 strokes. He is permanently disabled, all because his physician would not take his condition seriously. And of course, he didn't know that his blood pressure wasn't supposed to be that high. So these are things that are going on. Racism and discrimination is a very real issue that is having very real consequences on people's health. And then that brings me into kind of why I got into public health. So it's situations like that that really drove me to a career in public health. As you can see from the picture, I grew up in a very small plantation, sugarcane-filled town called Edgard in Louisiana. I always tell them from New Orleans because it's a lot easier to say New Orleans than Edgard, because then I get, well, where is that? It's very small. It is in between New Orleans and Baton Rouge. If you've seen Django, you've seen My Little Town. We've actually been in a lot of movies lately. I'm very excited. But we have no stoplights. We have no, it's very rural. We have no stores. I think we just got a Dollar General like a year or 2 ago. And that's really the only real store that we have in the town. So growing up, I got to see like kind of the real life effects of those social determinants of health, such as access to care and race. So I really watched a lot of my friends and their loved ones die from very preventable diseases, just from either lack of knowledge or their physicians weren't taking them seriously. And this is all anecdotal, of course, but the research is supporting it. Or they just didn't have access. The closest hospital from my little town was and still is about 30 to 45 minutes away. So even when you call 911, it's taking an extremely long time for the ambulance to get to you, for them to even administer any kind of life-saving treatments to you. And then to actually get you to a hospital is still another at least 30 minutes away. So that's kind of why I got into public health, just kind of growing up in that experience. But I had no idea what public health was. I always thought I would go into medicine. I had this idea of what I wanted to do and how I wanted to prevent diseases. And I just didn't even want to wait for people to get the disease. I just wanted to make sure that they were educated. I wanted to do everything I could to make sure that they had access, essentially trying to fix what I saw was wrong in my little town. I thought that was medicine. I come to find out later, honestly, in my master's program is when I figured out that public health was actually the route for me. So public health is a very upstream profession, whereas medicine and disease treatment is very downstream. So I really like this picture because it shows kind of the difference between the two. So you have this cliff upstream that for some reason people just keep falling into this stream. They keep falling into this stream and going downhill. You have people that are trying to pull them out, people that are trying to help them manage their diseases once they have it. You have the hospital that's completely downstream that's now treating their diseases. But if we stay at the end of this stream down here, we never really understand why people are being pushed into the stream to start with. And I'm not sure if you can see my cursor or not. But you never really understand why people are being pushed into that stream to start with. And that's really where public health comes in. We really take that very upstream approach to see, okay, we see people are in the stream. We have people who can handle the people who are already in the stream, who already have the diseases. How do we keep people from getting into the stream, period? And that is public health. Public health is very focused on the what and the how. So I love public health because public health is extremely broad. It doesn't really pigeonhole you into really anything. It's one of those things that you can really blaze your own trail. I've always said I want my own clinic. Again, going back to my experiences as a kid in my little bitty town, which is why I always said I wanted to go into medicine, but come to find out, I don't have to be a physician to open my own clinic. I can always partner with a doctor or a nurse or a physician assistant and have them work alongside me while I work on addressing some of these social determinants of health and preventing disease. So there are multiple things that you can do in public health. You can go into statistics and informatics, community health, emergency management, which I believe infectious disease would fall under there, which is this whole COVID-19 outbreak that we're seeing now, medical practice, global health, mental health. As you can see, there's just a wide array of that you can get into through public health. And I am very excited. I've said that I didn't put it in here, but I wanted to mention it. As far as degrees in public health, it is a very new thing that there are actually now undergraduate degrees in public health. So even if you do plan on going into medicine or nursing, or something else that's more very clinical focused, you can still minor in public health or even major in public health and get that knowledge. I truly, truly, truly believe working in a clinical setting, I didn't even mention where I work. I'm so sorry. I'm at Good Samaritan Hospital in downtown LA. But working in a clinical setting, I see a lot of people who essentially they see a disease when they see a person. They don't see the person. They don't understand how this person got to where they are. They're frustrated the person isn't taking their medication, but they don't understand this person literally cannot afford that medication. Or this person is having side effects that is now causing them to stop taking that medication. And they don't take the time to actually understand this person. So I get very excited when I see medical professionals who have a background in public health, because it really gives you an opportunity to see the whole person. It makes you a much more well-rounded health professional just in general. And rather than seeing a person's disease, you can actually address everything that person needs to improve their health. So even if you're looking into going into nursing, physician assistant, a doctor, MD, please, I urge you to please consider either minoring in public health or getting a master's in public health. There are a number of dual degree programs that you can do your MD and a master's in public health. If you are interested in public health, please consider doing an undergraduate degree in public health. I don't have nutrition up here, but nutrition is another field that you can go into in public health. It is extremely broad. I am so passionate about public health just because it really does take time to get to know people and to do the things that we do right. And you just don't have the time to do that when you're in a clinical setting. So you need people like public health individuals who can take that time to get to know what's really going on and address it appropriately. That way we can actually move towards health equity and solving some of these health disparities, which will actually come with prevention and understanding these populations, not just treating the diseases. And that is all I have for you today. Do we have any questions?
I have a question.
Sure.
Hi, my name is Jaylon Blackman. And as I was listening, I was hearing about how there's different ways to show awareness for the different public health disparities within medicine. But I wanted to know how doctors or physicians are being held accountable for their actions, because it's one thing to cause awareness for what's going on, and people can easily ignore the facts or the statistics, but how are they being able to be held accountable for the ways that they are treating the patients or treating the people that they're supposed to be taking care of in the medical field?
That is an extremely good question. I do not believe currently that there, other than maybe filing a complaint or having a malpractice suit against that physician, I can't really think of anything other than that to actually hold these people accountable. But public health professionals are actually working to develop different curriculums to actually educate physicians and their clinical staff on addressing their implicit bias. So that's really what it is that, well, it's not always implicit, but a lot of times they don't realize that they have these biases towards these particular patients. So a lot of public health professionals are trying to build out a curriculum to actually train these health professionals so that they are not treating these patients in that way. And right now, that's really all that we can do. I would love to, you guys are really our future. So if you have any ideas, please feel free to come to public health. I would love to have you in public health and figure out a way that we can fix this problem, because it really is a problem. But yeah, essentially malpractice suits and filing complaints. And then on the public health side, doing training so that these people, we can at least move them a little further away from being so biased. I wish I had a better answer. Any other questions? Feel free, ask me anything. I also teach, so if any of you have any questions about programs in public health or anything like that, feel free.
So if a student isn't sure if they want to pursue that field, what are the best kind of entry-level classes for them to get a great idea about what it's about when they go into college?
I believe most undergraduate degrees that I know of will have kind of an introduction to public health. Some of them will have health disparities classes. I know that that was kind of a huge driver for me, that kind of drove the point home, because again, I gave a very, very simple overview, and I mostly only focused on individuals of Black descent. So of course, there are a number of other disparities for Hispanics, Native Americans. So it's ridiculous how many health disparities there are. So I would definitely say looking into maybe health disparities or an introduction to public health class that would give you kind of an overview of everything that public health is. That way you can also kind of figure out what little niche within public health you want to go into. It may be global health, it may be medical practice, and you just want to have a more well-rounded view of your patients. But yeah, definitely intro to public health. A health disparities class would be great. In theory. Theories of health behavior can be very interesting. Any other questions?
My question is on, in public health, what is being done now with in the field of medicine, like those that are already doctors, that have been doctors for years? How are you promoting for there not to be health discrepancies here, disparities? Are there talks? Are you promoting more talks, more classes, or what are hospitals, or what are you trying to do in hospitals to change this?
So in hospitals, we have what's called grand rounds, which is essentially a kind of weekly gathering for educational purposes of all of the physicians in the hospital. And I try to really push to have some public health topics. A lot of hospitals actually do a really good job of having public health topics and addressing things like this, just to keep their doctors aware. I know I work with the American Public Health Association, which is the National Association for Public Health. And we do a lot of work around trying to kind of do a lot of interdisciplinary work. So working with doctors to get them to join APHA so that they can kind of see, okay, there is useful information here for you. You can actually learn something. And it actually hasn't been as hard of a push as you would think to get them to join a public health organization. A lot of them do see the need, and they do see the worth in being involved in an organization like that. And we do actually have a section specifically for those medical professionals. So there's a lot of cross-cutting work going on with public health, and as far as trainings and trying to get them involved in what we're doing so that they can understand. Of course, we can't force everybody, but those who are willing, we are definitely here to offer that information for them. Any other questions?
Hello, my name is President Ruji, and I'm very intrigued by your presentation. And I wanted to know that after Corona, did you have any ongoing research? Do you plan to do any ongoing research? Because I would like to take part of that.
Oh, yay. I do actually. So Parts of this presentation actually came from my dissertation for my doctoral degree, where I actually researched the impact of discrimination on glycemic control in American Blacks. But from that, I actually really want to come up with a way to measure kind of these large scale discrimination events that we're seeing. So things like Michael Brown, of course, everyone saw what happened to Sandra Bland, most recently the guy in Georgia. Right now, there's really no way to measure how basically we deal with that. A lot of the survey tools that we use can really mostly measure how we feel about the microaggressions, how we feel about those major life events. So we personally have had bad experiences with police, or we personally have been denied a job because of our race. But nothing really looks into how these highly publicized, clearly racist events impact our health. And I would love to actually try and come up with some kind of a survey tool for that. I would actually really love to do some research on stroke. Stroke is a new thing that I'm working in. I've been with Good Samaritan Hospital for a little over 2 years now, and I had no idea there was such a huge health disparity in stroke, which makes sense because everything that leads up to having a stroke are health disparities, so high blood pressure, diabetes, smoking, things like that. And of course, Blacks and Hispanics are more likely to have all of those. So it makes sense that we would also be more likely to have strokes. But for some reason, I never made the connection. So I would love to do more research on stroke because there's really not a lot out there to show how we can prevent stroke. It's been one of those things that we've been kind of just told to accept that as you age, it's going to happen. But that's not necessarily true because we are having a lot of young people now who are in the hospital with strokes. I would say about a third of our patients are between the ages of 35 and 55 who are having strokes. So it's definitely something that's worthwhile, I think, in researching, because especially since there's really nothing out there to say right now how to actually work with communities to prevent strokes. So that's kind of my future research aspirations, hopefully.
Okay, I have some theses as well. If I could get your email, I'll email that to you too.
Of course.
Maybe you could share your contact information that you would like in the chat, and that way the students that want to contact you have access.
Yes, I will do that. Once I stop sharing my screen, I will put it in the chat.
Absolutely. We can wait till the end.
Any other questions?
I have a question. What is public health doing to help with patients who don't have insurance or have insurance, but it doesn't cover immediate surgeries that they might need at the time? So what does public health do with that situation?
Very good question. So access to health and access to quality health insurance is actually a public health topic. So what do public healthers do? We are the ones who are usually on the ground trying to inform people of their options. So for instance, in my work with Good Samaritan Hospital, we do a lot of community outreach. So we're at farmers markets, well, we used to be at farmers markets twice a month, and we go to very large community events like Taste of Soul, the Central Avenue Jazz Festival, things like that. And when we come across people who do not have access to health insurance, they haven't been to the doctor in a while, I have actually come up with a system to where we get that person's contact information and we refer them out to one of our partners who then connects them to the health insurance plan that works best for them. So of course, if they're a undocumented immigrant, they then go into My Health LA. If they are not undocumented, then whatever healthcare system works best for them, whether that's Medi-Cal, or if they're eligible for other health insurance, we try to get them enrolled in that. So it's more so kind of an awareness and a systems-based approach. So we make sure people are aware of their options. And then we try to build systems so that if we come across people who do not have access, we can basically work with them to actually get access to something that's more appropriate. As far as quality of health insurance, public health individuals, a lot of us do a lot of work on policy, and that's really where like having access to like certain medications, certain surgeries, things like that, how we can actually work with Congress to make sure that that's included in these government plans, because there's really not a lot that we can do as far as what people are eligible for, as far as what type of plan they're eligible for, whether they can get a private insurance or if they have to get government insurance. But we can definitely lobby on behalf of what is absolutely necessary to go into that government insurance, and that is what public health has done. So you will see us, like when I go to Washington, D.C. on behalf of American Public Health Association, a part of those meetings is for me to actually go up to Capitol Hill and talk to my representatives. I always talk to my Louisiana representatives because I still vote in Louisiana. And I basically lobby to them about what's important, why people need to have access to healthcare, why they need quality healthcare, and what should be included when those types of policies come up. So that's kind of the role of public health in that. So making sure people are aware. We take a systems-based approach to make sure people can get access. And then we also work on policy advocacy to make sure that the policies, the things that are included in those health insurances is what's actually needed by the population. Ooh, I know a lot more about public health than I thought.
I have another question. The U.S. Census is going on right now, and often the groups that are most impacted by disparities are least likely to answer those questions because they're fearful of giving the government more information. So what is the role of the census with public health? How does it help? What is your message?
The census is extremely important when it comes to public health because the census is how they determine funding. So if people are not turning in their census, essentially your area will not get money to address any issues, not even just health issues, but address anything that's going on within your community, or they will be extremely underfunded because they fund based on how many people they think are within that area and what the issues are. But of course, if no one's responding, they assume I'm actually not sure how they make that assumption, but I would say they assume that it's less than what it may actually be. And you end up being either underfunded or mostly just underfunded. I won't say no funding because there's always funding, but severely underfunded is essentially where you end up. And funding, I can attest, is extremely important to keep some of these programs in the community that are trying to make sure that we are addressing health disparities, that we are trying to provide health equity in these communities, which I didn't go over, but it's another concept for another day. But yeah, definitely funding for your community is why the census is so important. They will absolutely underfund your community if you do not complete the census. And that funding is essential to make sure your community has the resources they need and enough for everyone. So please, guys, tell your parents, do the census.
I did mine.
I've done mine as well.
Did mine.
Any other questions?
For you.
Again, feel free to ask anything. If you want to know about the sugar cane I grew up around, feel free to ask that too.
Is there anyone else here from Louisiana?
Now, my daddy used to go on his bicycle and say, "Give us some sugar cane," and they'd cut it off and hand it to the kids, and they'd be on their way.
So I don't know if any of you students knew that, but yes, Miss Cooper from Louisiana too.
Those are my roots.
Yes.
Now, if you're interested in a degree in public health, I can say my alma mater, Xavier University of Louisiana, which is also an HBCU, does have an undergraduate program in public health as well as a master's program in public health. I'm going to go ahead and do a small plug. We are the #1 for getting racial minorities into medical school, specifically Black individuals into medical school. So if you're interested in medicine, Xavier is where you want to be. Some of these other schools try to say they are the #1. They are not.
All right, plug.
Yes, I love my school.
Excellent. Well, I really enjoyed that. I thought a lot of good questions as well.
Yes, really great questions.
Yeah, so I think the end point for me, or the thing that I'm going to take away, is that this is a great opportunity, even if you don't decide to go into supposedly public health, even if you are going to be a nurse or a doctor, it is still so beneficial for you to have the background, because it really changes kind of who you are, your trajectory, how you can impact and help people. So
Yes.
I hope that everyone enjoyed today. Again, I really am happy to see all of your faces, even if you are at home, and I'm at home too, or I'm at King Drew, but I'm at home. I'm gonna let you know that this was recorded. I want to be able to share it with other people. So I thank you. And Octavia, you are so patient. Your little brother, whoever, is just hopefully enjoy the presentation too. Got to learn a little bit about public health. But I appreciate all of you. Your teachers will be, I'm sure, know about your time with us here, how that will impact your grades or whatever. But again, we're happy that you're all here today. And if you don't have any other questions, we'll stop here and we will see you next week.
And I have put my email into the chat box for anyone. It's my personal email, so feel free to email me anytime, anything, any questions you possibly have. I love to mentor, so literally anything. I would be more than happy to help.
Awesome. Thank you so much.
Welcome.
All right.
Thank you. Bye.